Welcome back to my channel, Life on Tirzepatide. This channel is all about my real, unfiltered journey on a once-weekly Tirzepatide injection, and today's video is important. Over the last several days, something new has started showing up for me after injections, and I wanted to talk about it openly. Not to scare you, but to give you clarity. I want you to understand what might be happening, what isn't happening, and how to think through these signs if they show up on your journey. I've been on this medication for about 7 weeks now, and this reaction is recent, which is exactly why it matters to talk about it. As always, this is my personal experience, not medical advice. If you're experiencing anything concerning, you should always consult your doctor or healthcare provider. But if you're on Tirzepatide, considering it, or somewhere in the middle of this journey, this video is for you. So let's get into it. So on the screen, what you're looking at here are my last 2 Tirzepatide injection sites. Every week I rotate from one side to the next. So if I put it in if 1 week I put the injection on my right, the next week I put it on my left. And if I put it on my left, I put it on my right. On the image on the screen, you're going to see that they're red, they're slightly raised, and they itch. And what's important to note is that this didn't happen immediately after the injection. If you're new to this medication, seeing something like this can definitely raise concern. I know it did for me the first time. This is what's known as a localized injection site reaction, and it's actually very common with GLP-1 medications like Tirzepatide. The medication is injected into fatty tissue, where it slowly releases over time. And as it sits there, your immune system can respond locally, creating redness and irritation. So what's happening? One of the most confusing parts is the timing. You take the injection on day 1, and then days later, the redness or itching shows up. That delay doesn't mean something went wrong. It just means that the medication is releasing slowly, exactly as it's designed. Fat tissue doesn't have great blood flow, so the medication lingers longer, which can delay the immune response. Why the area itches? The itching is coming from histamine release. This isn't nerve pain, and it's not damage. It's your immune system reacting locally to something it recognizes as foreign. That's why it itches more than it hurts. Itching is an immune response, not an injury response. This is not a callus. It's not an abscess. It's not an infection, and it's not because the injection was done incorrectly. If this were infected, you'd see the spreading redness, warmth, increased pain, or fever. And that's not what this looks like. There are a few common things that can make these reactions worse. Injecting straight from the refrigerator, which is usually how I take the injection, right? Because this medication has to be refrigerated. Using the same general area repeatedly. It's something that I have constantly done for the last 7 weeks, obviously switching 1 week to the next to each different side, even if you switch to sides and you don't rotate regions properly. Also, injecting too shallow or pressing into muscle instead of staying in fat tissue can increase irritation. Here's what actually helps. Let the pen come to room temperature before injecting. Rotate the regions, not just left and right sides. Use the abdominal. Some people have said they use the thigh, the upper arm. You can apply ice for 5 to 10 minutes after the injection. It can help bring down the swelling, the redness, and in some cases, a non-drowsy antihistamine or a small amount of hydrocortisone around the area can reduce the itch. I haven't done any of those things. I've just kind of been allowing it to run its course. When should you worry? You should contact your provider if you notice rapidly spreading redness, increasing pain, warmth, fever, or a hard lump that continues to worsen. That's uncommon, but that's the line. The biggest takeaway here is this. This reaction is annoying. It's not dangerous. It's extremely common between weeks 4 and 10 as your immune system begins to adjust to the Tirzepatide injection. For most people, these reactions fade over time. this alone is not a reason to quit the medication that's changing your health. You got to stay consistent. You got to rotate properly. And don't let temporary side effects like this convince you something is wrong when it isn't. So if you're experiencing this, I'm curious to know your thoughts. And I would appreciate it in the comments down below if you share down below what you've experienced with injection sites like this. And if redness or the itchiness has popped up, what you've done differently to prevent it. Now, I know this last injection, I did press a little bit more into the muscle, probably, not necessarily the fat, because I was also testing out putting the injection in a little faster than usually what I do, which is I slowly push it in. So I just wanted to come on and share this with you and hope that maybe you can take away something with it as you continue on your journey with life on Tirzepatide. I'm extremely proud of the channel I'm creating here as I continue to document. I will continue to share what life is like on Tirzepatide. I'm down 25 pounds and I am super excited. You know the medicine is working, folks, when you can go your entire life eating donuts and all the good stuff that that probably caused the weight gain and the weight issues that you have today, the lifestyle you have today. For me, I know the medicine's working because the food noise is completely gone. My wife brought home a pack of donuts the other day. I looked at them. They didn't even look appetizing to me. And yet I still have not picked up a single donut. That's how I know this medicine is working. So the side effects, they're real. They happen. So far, I can tell you I've experienced nausea, right? Nauseousness constantly. I'll come on and share some remedies in my next update video with you guys that I've been trying out to calm down the nauseous feeling. Heartburn, it's there. It happens. That's because the food is sitting in your stomach a little longer. Gassing and bloating, again, that's because the food's not being released. It's holding in your stomach a little longer than usual. So it's fermenting. We got the side effects of the redness from these injections. So I think it's important that I just take this time to document. If you feel like it's a major issue, don't take my advice. Contact your local healthcare provider and create a follow-up appointment. But that's life on Tirzepatide. And hopefully you got value out of today's video. You hit that like button. Consider subscribing to our growing community. I hope this message comes across as something that can help you in the future when you make your decision on whether you want to go on this same journey. All right, guys, that's going to do it. I'll see you on the next video.